Good afternoon and welcome everybody to this year's first, actually this semester's first seminar on sustainable development. It's a great group that we got together on a real timely topic, growing up in an era of extreme events. If you're looking back over the past years or maybe a decade or so, we had seemingly an increasing number of these extreme events. Many people remember Hurricane Katrina, but we also had closer by Sandy, there was the Deep Horizon, there was the Ebola crisis. So different things popping up, and all of them seem to be somewhat related in the grand scheme of things, although they are distinctly different. And the question that is common to all of them is, how do we deal with them? What are our responses to them? And that is really where we have the experts here today to talk to us a bit about, how ready are we? And if we are ready, what does that mean? What might we have to do in response to one of these events, which undoubtedly will hit us again? And typically they come out of a corner that we don't expect at a time when we don't really expect it. Many of you probably recognize him by his voice when you drive along, and there is one of these events. You can hear him come on NPR and other media, and immediately I know, oh, this is Irwin, without even listening to who is announced. He's the director of the National Center for Disaster Preparedness at the U.S. Institute. He's by training a pediatrician, I believe, and at the NCDP. He works to understand and improve the nation's capacity to prepare for, respond to, and recover from disasters of all kinds.
The topic's a little bit grim, but we're going to try to go through some key points about disasters, and Jeff is going to put it in the context of Sustainable Development Goals and sort of the status of the world in relationship to the issues that we're talking about. But I just want to make a confession to you that our program is called the National Center for Disaster Preparedness. So I know what national means. I pretty much know how to define a disaster. Preparedness, I don't know. I've been actually struggling with it, and you'll see why, because it's really not clear what we mean by a prepared world or country or community or individual for that matter. So we're actually, in our programs, in our discussions, our research, we're aiming towards an elusive conceptual goal that's relative to the current state that we're in. And I just want to mention that beforehand, that before we start getting into some of the specifics, that we kind of know what we're talking about, when we see it, but the fact of the matter is that it's an elusive definition. What we're going to try to do today is go over the current landscape of disasters as we see them. And I think the public's attention around disasters came to a head after 9/11. And since then, a lot of things have happened, as Peter mentioned. The question is, what are we looking at right now? What is germane? How do we create priorities that are the things that we're most concerned about and want to focus on? So I'm going to mention a few particular scenarios that I just want to open with about the kinds of things that we would put in. There's two categories, basically. One are the no warning events, and the other are more or less with warning. I have a different term that I'm using now to describe them, but just to give you a flavor of what we're talking about. So this, of course, is this is on the pointer's not working on this. Oh, here's the pointer. Okay. This is the city of San Francisco after the 1906 earthquake that destroyed that city. And the reason I have this here is there's been quite a bit of speculation about another major seismic event that is potentially going to happen certainly within our lifetimes, in somewhere on the West Coast. And this is something that the country is extraordinarily unprepared for. We haven't reinforced sufficient structures. We haven't really had sufficient exploration of what are the options in response to such a thing. And I'm just mentioning that we're not going to really go into detail about this, but this is '06, and it's a question of when and if, sort of more when rather than if, we'll get a big quake on the West Coast. This represents the fact that one of the no warning events that we think about a lot is the possibility of a virus or bacteria becoming something that basically gets out of control. We talk about pandemics, and this represents a virus. This is the Nipah virus, which actually is a very lethal virus for humans. It is not aggressively transmissible among people, but it could become, through mutation, quite transmissible at a moment in time that we really cannot predict. And it is representative of a class of microorganisms that, in fact, could be responsible for worldwide pandemic that could have extraordinary consequences for the whole planet. And by the way, I'm going to keep referencing some of the things that Jeff will probably go into. So the more fragile the society in its developmental trajectory, the more likely any one of these things could have a devastating effect and really pull the rug out of any progress that might have been made over the last however many years. So pandemics is another thing we're worried about. Jeb Weissman a little bit later is going to talk about cyber threats that we're now facing in the world, and he's got a very interesting take on that. I am going to mention here, this is the Fukushima disaster that we know happened in Japan a few years ago. There is a degree of risk associated with nuclear power plants for a variety of reasons. I'm not going to get into that either. Just yesterday, the Associated Press revealed a long-term investigative report on the selling and buying of enriched uranium on the black market, in particular in relationship to potential terrorist organizations. So I'm mentioning here, and I may come back to this a little bit later, the possibility of a nuclear device being bought, stolen, or built by an organization that is interested in serious creation of terror and disruption somewhere on the planet. The other no warning event has to do with the tremendous fragility of America's infrastructure. Overall, the American Society of Civil Engineers is projecting that it would cost about $3.7 trillion, that's with a TR, to really fix America's infrastructure. This is the Sacramento River Valley, and much of the levee system there is made from mud mounds, similar to what we have been seeing the last few days, really, in South Carolina. So this is a big disaster waiting to happen that if on sufficient weather conditions, this could overflow easily these very, very inadequate levees, and we'd have major flooding of the city of Sacramento. So these are things that could happen, relatively speaking, without warning, most of which we're really not even remotely prepared for. But I wanted to focus a little bit more on something that I would like to refer to as slow motion catastrophic disasters. And this bucket includes a lot of things that you may or may not be aware of. And one of them has to do with the vast cascading consequences of climate change. And Adam and Elisa are going to talk about some of that later, but I'm just, for reference, showing an area of severe drought in California. So that is one category, and you're going to hear more about that with the panel. The second thing has to do with something that I'm personally very concerned about, which is the development of superbugs, that is, microorganisms that have been mutated so that they are no longer responsive to large numbers of our antibiotics. This is a really big problem, and in fact, there in the United States alone, last year there were 2 million people infected with what we refer to as a superbug, 23,000 fatalities in the U.S. alone associated with superbugs. This has to do with, among other things, tremendous overuse of antibiotics. Why is that? Because pharmaceutical companies are pushing them, patients are demanding them, and doctors are loosely prescribing them. So that the human use of antibiotics has been out of control, and mutations have developed. But probably equally important is the use of antibiotics in livestock. So chickens, beef, etc., are very often given large amounts of antibiotics from the moment of birth through until they're slaughtered for human consumption. That also is creating these bacteria that are antibiotic resistant, a very big pending problem. This one up here, this ugly picture on the upper right is MRSA, methicillin-resistant Staph aureus, And it is an example of the kind of situation that we're talking about here. On the bottom is something that we've recently begun to focus on. This has to do with this massive refugee crisis that the world is experiencing. So estimates are that across the globe, 40 to 50 million people are displaced from their communities. That means at least 10 million children are among those people and populations that have been displaced. And we've written a little bit about this, but the fact of the matter is the average duration of a child who has been seriously displaced, not from an acute event that can be fixed and they can go back to their communities, is 17 years. So in essence, we're talking about entire childhoods spent in situations of displacement, extraordinary vulnerability, and high risk to these kids. Syria, for instance, which obviously has been in the middle of a horrible civil unrest for years now, has actually used to have a very good educational system with over 90% literacy among children in Syria. 50,000 teachers have left Syria, gone, killed, disappeared. Schools are shut, and we have children who are 9, 10, 11 years old who haven't gone to school for 3 or 4 years. They're now displaced out of the country, and I don't know what it is the world expects to happen to those kids, but I'm anticipating that this is not going to be a good outcome for them or the rest of the world. And I've been pushing for much more global attention to the plight of these kids, and I think something needs to be done. But these kids are at high risk, and the societies which they'll occupy are at high risk as well. So these are the more gradual catastrophic disasters that we don't normally put in the category of, let's say, a severe hurricane or an earthquake, but they are extremely troublesome nonetheless. The overall report card for how we're handling preparedness is not good. We have big-scale disasters that are accompanied by very small planning. We have an extreme aversion to prevention. The things that we know that could reduce the chances or likelihood or mitigate disasters, we simply are just not taken care of. We don't have a mentality that I've been able to identify in the U.S. at least to say really it would be much better to prevent these situations that we've been talking about and make the investments and the resources available to help deal with them. And the other thing has to do with a failure of imagination about disasters. I'm going to come back to that in just a moment. So overall, D plus. If I get on the wrong side of the bed, it's otherwise it's a maybe D plus, C minus. C minus is the grade. I want to just quickly go through two categories of issues that impair progress around preparedness. And the first of these is the scale and resources and something I refer to as the denominator problem, which I'm going to explain. And the second has to do with the structural issues and the accountability issues with respect to oversight of disaster management and prevention. And then the third, something I've been calling disaster learning disabilities. And I'll explain all this right now. So the first thing is that we don't have a grasp or a grip on exactly the scale of some disasters that we might think we've been preparing for. And let me just start with an example of a potential pandemic flu as it might impact New York City, which has a population of 8.2 million. If we had an avian flu pandemic of the type we were talking about in the 2005-2006 era, we're talking about an attack rate of 30% of the population would get this virus. That doesn't mean everybody is lethally, fatally ill. It just means that everything from mild disease or no symptoms to deadly consequences from this situation. 10% of those who got the virus would require hospitalization, and the mortality rate would be around 2.5% of the population in New York. So what that would mean is that we'd have, over the course of the pandemic, almost 2.5 million people who would get sick with this virus, including 600,000 children. That would mean 60,000 deaths, including 15,000 pediatric deaths and 200,000 hospital admissions. So the cascade of events that follow such a situation has to do with tremendous stresses on every system imaginable. But just taking the health system and the medical services system, we certainly wouldn't have a vaccine available, and certainly not at any kind of scale that we might need. We won't have enough antiviral medications. We simply are very, very remotely distant from having sufficient number of hospital beds, ventilators, et cetera. But what's also important to understand is that the cascade of events from isolating people, from loss of life, from people staying home to take care of their children are tremendous consequences for the education of kids, for the local, national, and maybe international economy, and so on. Real troubles that are emanating out like ripples from a stone thrown in a pond that people have really not really grasped or made any plans for whatsoever. The notion, by the way, of assistance from the outside in a pandemic is not going to happen, because since it's a pandemic, it's happening everywhere, so we're not going to be getting help from Boston, Atlanta, Washington, and so forth. We'll be on our own, as will every other city in America. And this is a reality that no one really likes to talk about, because it's not really clear what you would do about it, even if you did think about it. But it is a problem. The Indian Point Energy Center is the euphemism for a nuclear power plant, and I know there's a lot of controversy about whether people think these are a good idea or not a good idea, but whatever you think, if there were a meltdown, Fukushima-like, at Indian Point, which is about 26 miles from where we're sitting right now, within 50 miles of Indian Point live 17 million people. An enormous presence, and depending on what the atmospheric conditions might be and other factors, a lot of people would have to be evacuated from this area. And one of the points that I've made actually to the governor and others, as many people as I could get to, is that there have been essentially zero plans made to accommodate large numbers of evacuees coming from the metropolitan area. So I guess what would happen is tens of thousands, hundreds of thousands of people evacuating from this region, arriving in, I don't know, get off the New York State Thruway, exit 17, I guess, and stop by Goshen, New York, where there are no hospitals, no jobs, nothing, zero has been done in any part of the United States to deal with potential evacuees from a nuclear power plant meltdown. Not a good thing. The idea of nuclear terrorism, I told you that there's really serious heightened concern about the acquisition of enriched uranium or plutonium by terror groups. One of those detonated, by the way, would not be an existential threat to life on the planet. This is not the Cold War. This is not 40,000 nuclear warheads pointed between the Soviet Union and the United States, as it was in the late 50s and 60s. But this is nonetheless obviously a major event that would be just horrific beyond description. But I wanted to point out this fact about it. So there are 6 places in the U.S. that are considered potential high target zones for nuclear terrorism. So it's Los Angeles, San Francisco, Houston, Chicago, Washington, and New York. There isn't a single one of these cities that has what any of us would probably consider even minimal readiness for this. By the way, I'm not suggesting that we do, but I'm suggesting we don't ignore it. If we're going to ignore it, I really would like that to be proactively after some discussion. For example, if we have extra resources, I would like to see those invested in, say, access to health care for children, not necessarily preparing for a nuclear weapon. But a lot of what we do is very much by default, and that's a problem in terms of disaster planning generally. I'm going to skip that. So a relatively small nuclear device that, let's say, occurred in Midtown Manhattan would have a significant amount of casualties and deaths, obviously very, very significant, horrible event, but this is what we'd be looking at relatively immediately. But the total hospital bed capacity in New York State is less than 40,000. Now, obviously, people who survive would be going to other places, but just to give you a sense of this, and by the way, those 40,000 beds are pretty occupied, and there would be no warning for this kind of event. So we'd have a very, very major problem, not just with the initial detonation and act of terrorism, but what we would do in the aftermath. And I don't really want to dwell on that other than to say it's just another example of things we're not really prepared for. So, this is what I was referring to as the numerator-denominator problem. When you talk to people who are planning for disasters and you say, how are we doing? They will give you a number that actually is the numerator in this illustration. In other words, the Department of Health will say, we have stockpiled 1 million face masks, N95s, in the event of a pandemic. But what actually is needed may be 300 million, because you have to change them every 4 hours. It's a whole big deal. So 1 million, which sounds like a large number to the press or to the public, is actually completely, essentially irrelevant to the scale of need. And another way of putting that, if we're, as far as preparedness is concerned, if this is our starting point and this is our current state, we're never going to be 100% prepared, and I hope no one even thinks that's reasonable to think about. But let's say we wanted to be here on this spectrum. You could say we've either made progress and we're doing fine, or we're way behind because we haven't gotten here. This becomes a judgment call and actually drives decisions about how much resources from the public sector are going to be invested. So do we want to put a lot more money in and get closer, or do we want to use whatever resources we have available to do other things? I don't really have an answer for that, but I just want to point this out. The second bucket of challenges that impair progress around preparedness has to do with structure and accountability and jurisdiction. So the question of who's in charge, and I'm just going to mention two quick things. One is that the reality is that the federalist system that we live under in the United States absolutely does not work for preparedness. The federal government has literally very little control over what New York State or New York City does about preparedness, and about a lot of other things for that matter. And in some states that have home rule, like Texas, the governor has very little control over what happens in a local community or town. The mayor determines that. This diffusion of responsibility and authority for things, and in our case we're talking here about preparedness, is a major barrier to having some sense that the country is prepared as a whole. It's really a problem and very difficult to figure out how that needs to be addressed. On the global scale, some of you may be aware of the fact that the World Health Organization has been profoundly criticized after multiple investigations in terms of their response to Ebola, which was first of all delayed, and second of all very, very inadequate on many, many counts. And if you get a chance to look at some of the analysis and reports, there's a new one coming out from the Council on Foreign Relations shortly. The World Health Organization, which I think many people might instinctively think was the place that would oversee a global challenge like Ebola, actually pretty much failed to do that. On the other hand, who should do that? You can't have an international organization march in and take over responsibility for the legal government authority and responsibility of a country. It just doesn't happen, can't happen. But when the country is dysfunctional because of a horrible disaster, for example, like the earthquake in Haiti, it is not clear how and who oversees and takes responsibility and is accountable for the outcome here. I'm just putting that out there as maybe something we can discuss later, but I'm concerned about this issue of authority and responsibility for disaster response, both in the US and internationally. The final point is this issue about whether we do or don't learn from our previous disasters. So we have experiences. So the experience might be flooding in South Carolina, or it might be 9/11. We have lessons learned. I've been to, 50 lessons learned conferences after every major disaster. Same routine. You get officials come by, they talk about what we did wrong and how we're going to be better next time. And that's about it. That's where it ends. So if you look at it this way, so we have the experience, which is often called a wake-up call. I was speaking to a reporter in South Carolina yesterday, and they had a lot of issues with their levees down there and a lot of flooding, more to come. He said this is going to be a big wake-up call for the state. I said, don't count on it. Because really what happens is we can articulate the experiences as a lesson learned. That's easy. But what's not so easy is applying those lessons, fixing what was wrong, putting the right amount of resources in there, and letting the experience from before serve as a mechanism for doing better the next time a disaster happens, or make us more resilient and so forth. And this is a big problem. So told them this is not really, these don't really happen as you describe them as wake-up calls. They're really more like snooze alarms. What happens is there's a lot of arousal. Everybody's waking up. They're kind of focused on the event that's happening. There are reporters everywhere, whether it's the Newtown shootings in Sandy Hook, or it's a big natural disaster. A tremendous amount of attention and a lot of rhetoric about what we could do and should do in the future. And the problem is that when the cameras leave and the reporters are gone, we hit that snooze button and we drift back off into complacency. And that's a real problem that again, maybe we can get a chance to discuss that coming up. What I did not talk about, and I could later if we had time, is the issue of recovery from disaster. And the last point I'll make is that of all the cycle of disasters, prevention, readiness, response, mitigation, the recovery part is where we have the most difficulty. This is internationally and here in the US. That's why we have probably, 20,000 people in New Jersey still not back to normal after Superstorm Sandy. We still have a devastated community in the lower ninth 10 years after Katrina in New Orleans. So it's a whole other discussion. Maybe we'll reconvene at some point if Peter allows us, and we'll talk about recovery, disaster recovery. But it's a real problem, and I think related to the resiliency of societies, and maybe Jeff will brush on that as well. So Jeff, would you like to come up?
Irwin, thank you for that terrific overview, which really was both comprehensive and shows what it means to be thinking about this so deeply, and thank you for doing that, and thank you for pulling us together, because we can't have enough of these meetings, it seems, until we make the kind of breakthroughs that are needed. We're speaking today about extreme events, but already I think you made an extraordinarily important point, which is that while individual events are unpredictable, what is predictable is the increasing frequency and the nature of the risk of many of these events. And so we're standing almost blind, despite the fact that a lot is known, and a lot is known among our colleagues here about estimating frequencies, risks, and so forth. And what we also know is that for a number of reasons, the kinds of events that we're talking about today are rising in frequency, or at least rising in the numbers of people that are impacted. So the vulnerability and exposure to these risks is increasing. You mentioned a number of categories. I think it's worth us keeping these distinct in our discussion going forward, because they do have different causes and different mechanisms of preparedness and response. But definitely hydrometeorological shocks, especially related to climate change, are on the rise and should be expected to continue to worsen. And we see all over the world droughts, floods, extreme storms, and reasons to believe, and we'll hear from one of the great experts, that these are related to anthropogenic climate change and therefore are likely to intensify in the future. We're suffering from a large number of ecological shocks because there's a tremendous amount of ecological displacement, meaning collisions of ecologies and biodiversity, genetic recombination of microbial pathogens that didn't occur in the past, or that is occurring at greater frequency. Most of the emerging diseases or re-emerging diseases like the Ebola infections are zoonotic, so they involve some kind of transfer of a pathogen from an animal reservoir to a human reservoir, and a lot of that is occurring because of humanity pressing upon ecosystems that they weren't deeply engaged in the past because of migration, population pressures. We know that bushmeat eating was presumably partly responsible for the biggest zoonosis of modern times, which has been the AIDS epidemic. Ebola, the most recent round, is perhaps related to bats although nobody is absolutely certain how this latest occurrence arose. But we're seeing a lot of this, and we're seeing a lot of recombination of genetic material, probably also related to industrial production of poultry, and almost a machine of recombination in China, where a lot of the new flu varieties emerge every year. Then there is no end of geopolitical, military, security, terrorist kinds of incidents and shocks, and Irwin mentioned a lot of those. And we can add cyber insecurity to the list now, and we're going to hear about that, and that's really important because we live more and more on a network that we assume is always going to be there, and everything that we need, more and more we put on there, and it's highly vulnerable, no doubt. And so this is actually a quite serious concern. And then I would say what we really find increasingly are highly complex disasters that have a bit of everything in them. And the Syrian bloodbath right now is the kind of perfect storm that reflects, on the one side, underlying ecological triggers in a decade ago of extreme drought and population displacement, very bad governance that led a brutal regime to respond to unrest with brutality, a tremendous amount of geopolitics because the U.S., Turkey, Saudi Arabia all wanted to overthrow that regime, probably at the slightest pretext. But when the pretext arose, all of a sudden arms flooded into the region. It happens that regime is an ally of Russia, so Russia's bombing in Syria and Iraq today is not outside of the kind of response. The sad truth is we know from history that this kind of continuing escalation sometimes has no end. It took one bullet to start World War I after it triggered a cascade of madness of response, threat, counter-threat, escalation, launch of war, and so forth. And so we're constantly living in that kind of spiraling risk as well. But Syria, to my mind, reflects the fact that such disasters don't ever have single, or I shouldn't say that, these days often do not have single causes and often are highly complex, spanning ecological, demographic, ethnic, geopolitical factors, and bringing them all together and making them extraordinarily difficult to address. All of these shocks we should expect will rise in frequency. Some of them can be modeled in terms of frequencies, although most of them do not lend themselves to high skill of short-run prediction, but some skill of long-term frequency estimation and identification of areas of particular risk. It's even possible to make assessments of where risks of war outbreak are. We've had a group here working on that for quite a while, and there's a lot of ability to predict that certain places are vulnerable, especially very poor places, and not surprisingly because they have very fragile socioeconomic systems. A second major point that is obvious but needs to be stressed is that every one of these crises that I know of evidences a special vulnerability of the poor. So almost any shock, you look at the eventual consequences of the shock, it can be related to socioeconomic conditions of the population at the time that the shock or the unraveling occurs. And the poor inevitably lose more. One could imagine some counterexamples, but there are very, very few indeed. And we've seen that in every case in the U.S. Shocks like Sandy or Katrina, but this is a worldwide reality, which is that in many places the shock hits and the rich walk away and the poor die. And understanding the nature of that, and John Mutter has worked very hard on that issue for many, many years to try to understand that, is important for us. Often the poor live in the most vulnerable places. They live on steep slopes, they live near the riverbanks, in places, floodplains, in highly vulnerable places where they've been pushed because that's the last place that they're tolerated, so to speak, in the society, or the place where they can get a foothold since they don't have other resources. So they're already living precarious lives. And if you look in the world today, very poor people live in drylands, highly vulnerable to drought and to food crises, for example. Not surprising, therefore, that they're more impacted. But of course, the rich always have access to resources, their own buffers, and their call on governments that are pretty quick, whereas the poor don't have such resources. It's not quite apropos of this, but when the 2008 financial crisis hit, the Wall Street Journal ran an editorial about 5 days after Lehman fell that, "Are you idiots? Don't you know there are market failures and we have to bail out the banks?" Which was the only time in 20 years that I know that the Wall Street Journal acknowledged market failures. But it acknowledged them for the rich, the richest of the rich. It never would say they're market failures for the poor. But to me, it's an illustration why the poor suffer. They don't get the editorials written for them. It's the rich and the powerful who are able to, if they don't have the buffers themselves, are able to find them. So there's a tremendous amount of scientific validation of the principle that any of these shocks has hugely unequal socioeconomic impacts. A third major finding, and Irwin is exactly at the intersection of the disaster world and the children's world, is that young children are extraordinarily vulnerable to shocks, and much more than we can imagine. And the reason is that they're developing. And it turns out biologically, you don't get too many chances to develop. And if you miss the normal biological progression of healthy development, there isn't easy catch-up. We know this, we sense this, we have our own knowledge and experiences of this. But the biology is now increasingly clear that even fetuses that face the stress of the pregnant mother during one of these episodes of disaster, or children, very young children who face episodes of disaster, may never recover, actually, especially if they face a period of nutritional stress or psychological stress or familial displacement. And therefore, we should be paying attention always to the children. For us, grown up, we are to a greater extent what we are, and we can perhaps bounce back from a disaster. But children cannot bounce back if they have a period of extreme stress caused by one of these episodes. And more we find evidence of this, and more we understand the biophysical pathways, the cortisol pathways of stress for young children, leading to long-term debilities in health and cognitive development, or nutritional stresses early on that are never repaired, and so forth. A fourth finding of a careful scientific study of disasters undertaken, I'm proud to say, by many of our students in the PhD program in sustainable development in recent years, and by our colleague Doug Almond and others at SEPA, is that these shocks have very, very, very long-term consequences. And this was almost unknowable in the past, when the statistical means to identify consequences of these shocks simply didn't exist. But what Doug Almond showed, for example, in research a decade ago, was that if a fetus was in a place that was exposed to the 1918 flu epidemic, the child and later adult that emerged statistically had a much greater chance of various disabilities 30 years later, 40 years later. And so the consequences of early exposure to these shocks is very, very significant. And this kind of research was almost impossible to do without some of the advances in household data sets, longitudinal surveys, and so forth. But now there have been a series of confirming findings. And what they show in general, for example, by Sao Sheng, one of our star PhDs in sustainable development, who has studied the impact of typhoons in the Philippines. It's that children exposed to those typhoons, or even as fetuses during the period of typhoons, face much higher risks of early childhood mortality stretching out for years. And so the consequences are not, as we sometimes would have thought, if you made it past that first week, everything was fine and you would catch up, but rather because of deeper biological consequences. And now it seems mothers don't breastfeed as effectively after shocks. Perhaps they're unable to, or undernourished, or without the time or the capacity or separation of families and so forth. You get long-term consequences that can be carefully dissected if you have big enough data sets, basically, to find evidence that was otherwise not perceptible immediately on the surface. And I collected a series of these just running in this morning. I'll give you just a quick shorthand. Two of our PhDs, Jesse Antilla Hughes and Sao Sheng, who I mentioned, studying the Philippines typhoon, showed that the infant mortality effects last for several years into the future of higher infant mortality effects. Another paper of theirs showed that the economic growth consequences of these shocks is a decrement of growth, but rather small, but lasting 15 years. So that rather than seeing one big disaster, which would have been my mental image, and then you either climb out or you don't, it's a long period of loss of growth potential, when cumulated over a period of 15 years, basically is taking away a lot of the economic development of these highly vulnerable societies. So it took a massive data set and then a lot of skill in linking the data set to hurricane and cyclonic disturbances to be able to ferret out what otherwise wasn't so perceptible, that the long tail in timing means that the consequences are very, very large, even if you don't notice them jumping out at you in the macro data from one year to the next. Then more studies of intrautero exposure to flus, to in Dutch women during the last year of World War II, a massive famine that was war-induced, and then studying children who were in utero in the winter of in the fall of 1944, winter of 1945, with serious liabilities in their life trajectories 30 years later. And this is controlling, as you would in such studies, for many, many other factors. But those few months of being in those months in gestation turns out to have these long-term effects. There are suggestions that children who are in the first trimester during Ramadan may have consequences if mothers are fasting. And so this is also another imperceptible finding, which is now being shown in very large data sets. So this is another point that I think is extremely important, that both at the individual level and at the societal level, there's a long, long period of consequence for these events. The next point, obviously, I won't belabor it, also given the time. Our societal responses are very, very weak. We simply lack institutions and perhaps even the cognitive makeup to be able to look at these kinds of challenges in a rational way. By rational way, I mean the way we would in a decision analytic framework where we say we have these risks, we have this well-being function, we have this probability distribution, what is the optimum degree of preparedness, what's the optimum institutions for response. That's how one would think about this problem in a kind of engineering framework. But our societies seem not to do that at all, which is why, incidentally, we're going into COP21 in Paris in early December, meaning 21 years of negotiations with no success in reaching a climate agreement so far. It's not as if we don't have the evidence. And so this is just one piece of, one kind of example. But every time an earthquake hits, as in Nepal last year, oh, well, we had a building code, but it was never enforced. And so the buildings crumbled, or in Haiti, or when such shocks happen in many other places. What's true is that a few places hit by major shocks show that they did plan ahead. They did implement a building code, say the Kobe earthquake, compared to the Haiti earthquake, which almost had the same magnitude and the same distance of the major city from the epicenter, and one had a few hundred deaths, I think, maybe 5,000, and the other hundreds of thousands. And so there can be learning potentially, but in general, there is not. And I know we're going to talk about that with Hurricane Sandy. One lesson, why are backup generators always below the flood level? This seems to be a bad idea. It was a bad idea in Fukushima. It was a bad idea in New York City hospitals. It's something that where you would imagine we could learn something, but we actually don't even learn that basic point. One interesting, dismaying fact for me from a UN point of view is that despite the fact that every year the UN is handling dozens of humanitarian emergencies, there is no funding mechanism to address them. Every single humanitarian emergency, I shouldn't say that, what there is an unbelievably deficient, almost deficient to the point of weirdness system, which is that when the shock occurs, you estimate the needs and then you go out and beg for countries to give emergency help for that. This is unbelievable. There's no doubt that the UN will need billions of dollars every year, but no money is put up front. Every single one of these disasters requires going cup in hand and having donor meetings, having emergency meetings, finding out that the pledge is only 20% of the ask, and then that pledge never materializes afterwards also, because that's just the headline for the photo op. It's not the actual money that ever materializes. So we lack completely a financial structure. So what would this mean in terms of true preparedness? This is a question that Irwin asked, and the closest we come to that analytically is a model of insurance. And an insurance model is a model where you try to calibrate as through best statistical means, frequency statistics or Bayesian analyses, a probability distribution of risks. You assess the kinds of investments that can be made in risk reduction, in mitigation, in risk preparedness, in risk resilience, and you implement financial mechanisms for risk response and for insurance. Insurance means transfers of income when bad states of nature happen to buffer those who are hit. We don't have anything like that operating, even for the most predictable seismological or hydrometeorological shocks. We don't have an international, we do have it for private insurance, but the private insurance inevitably covers only a small part of the actual risks and almost no place in very poor countries. One of the best parts of good insurance mechanisms, more or less like the building insurance in New York City, is that to get an insurance policy, you have to take steps of risk reduction and preparedness. So to have a homeowner's insurance policy, you have to show that the house is equipped with alarms, with the sprinkler system, with other risk reduction mechanisms. So insurance is not only protecting against a bad occurrence, it's reducing, if it's well-designed insurance, it's reducing the frequency and the severity of those occurrences as well through cost-effective preparedness mechanisms. One of the things we should try to do in the international system is to implement some kind of public-private insurance system, maybe literally with the insurance companies, to cover a lot of the risks that are not covered, but to use that as a leading wedge to insist on preparedness and to insist on meeting insurance covenants that building codes are there, building codes are being enforced, other preparedness standards are there, floodplain warnings are being heeded, only certain areas will be covered by the insurance and so forth. We have none of those feedback mechanisms that I can see operating right now at a systemic or policy level for almost any of these shocks. One good thing about insurance that I can mention that is the counterpart to the long tail of costs from bad shocks is that there's an equivalent literature which says that timely insurance has very, very long, predictable, beneficial consequences. So there are recent articles that show if poor children are covered by health insurance, 30 years later, they're much more likely to have a job, much more likely not to be in welfare, much more likely to have had a decent education. And so insurance coverage is really the flip side of disaster exposure, in that it also has a very long tail that is not necessarily perceived, but only now with good longitudinal studies are we able to find the very long-term benefits. This is also, by the way, related to findings on early childhood development programs, Head Start and others, where the short-term conclusions were can't find an effect, maybe not cost-effective. But when Heckman and others took out the implications of being covered by such programs 20 years or 25 years, they found very powerful effects. It was only the short term that they couldn't identify the effects. So it has something like the shock phenomenon of small benefits that accumulate over a very long period of time. And so we know that insurance would have a very, very meaningful, beneficial effect if we thought through this. Two more points that I want to mention. One is the role of technology. Technology can play an enormously beneficial role on all parts of the insurance value chain, on predictability, skill in forecasting, in risk reduction, in disaster response, simply text messaging, codes, alerts, and so forth can save vast numbers of lives. When Hurricane Mitch hit in Honduras and 10,000 people died, they died in their sleep because nobody bothered to warn them that upstream a massive flood had developed, and they died drowned on the riverbanks rather than in some violent immediate way. It was predictable for hours, but Honduras didn't have alert systems. We know that even very, very primitive or basic, I should say, safety systems, like in Bangladesh, to climb ladders to get out of floods, has saved vast numbers of lives. So good technology can make a huge difference on all dimensions, and we should be thinking about this in a very systematic way, especially at this university. The final point that I want to mention is that last 2 weeks ago on September 25th, the world adopted a new cooperation framework, the Sustainable Development Goals. That will be our global diplomatic framework for cooperation around development issues and these disaster-related issues for the coming 15 years. I am giving the homework assignment to everybody in every speech: go home and learn all 17 goals. Time is running out for you to be the first in your family to do so, because you'll find out that your brothers, sisters, kids, parents already know them, because I've already talked to them. So you have to go home and hurry to learn these 17 goals. But interestingly, and good news is, there are 5 specific targets on disaster risk preparedness. This is not a forgotten issue in this list. And these are instructions for us, and they're leverage points for us as well. So in SDG number 1, it's end extreme poverty. Target 1.5 under that is resilience and reduced exposure and vulnerability of the poor to shocks. SDG 2 is sustainable agriculture and food security, and target 2.4 is food resilience in the face of climate change. Target 11 is sustainable cities and human settlements, and target 11.5 under SDG 11 is reduce global deaths and losses from natural disasters. I don't remember exactly how it's stated, but it's very clearly along our lines. And target 11.B under SDG 11 is that every polity, national and local, is to make plans under what's called the Sendai framework for disaster risk reduction on how to address these emergencies. So there is a global call for systematic planning. And then SDG 13 is to stop human-induced climate change, and target 13.1 under that is to increase the resilience and the adaptive capacity of societies to anthropogenic climate change. So we have a framework, we have some leverage, we have some global goals. This is very timely. Let's put some content into them. Thank you.